Welcome everyone. This is the third webinar in the series where we are going to talk to you about the work that we did on VR with Leeds Children's Hospital. I am now going to take you to the next slide. So my name is Sandy. I am the head of Insight and Impact at Starlight, and I will be chairing this session. And joining me in facilitating this session is Amanda Kostrinska, who is our Service Insights Coordinator. She will be answering your questions in the chat and facilitating the Q&A. So if you have any queries or anything, please let us know and Amanda will respond. I'm also delighted to have Tracy Martin, who's a health play specialist at Leeds Children's Hospital, and Lisa Beaumont, who's our head of play, joining us from Leeds Children's Hospital, and they will form part of our panel. So this is a very star-studded panel. And so just to take you through the agenda, please can I ask that everyone switches off their microphone? Thank you. We are going to start with a short introduction for myself, and then Lisa is going to tell you about the build up to this project and the work that we did. And Tracy then will take you through our VR story, the expectation of doing this work versus the reality. And then I shall be taking you through the impact that VR had on treatment as a result of this work. And Lisa and Tracy will tell you what happened next at Leeds Children's Hospital and how this work has impacted on the work that they do at the hospital. There will be an opportunity to ask questions at the end, and then I'll take you through the next steps of what we're doing at Starlight in terms of VR. So buckle in, it's an exciting presentation. So just to give you a bit of context, Starlight has partnered with Leeds Children's Hospital and Leeds Hospital Charity to look at new ways to improve the delivery and experience of treatment in hospital, as well as reducing anxiety and stress of children and young people in hospital. And at that time, when we joined this project, Starlight had received funding from True Colours Trust to look at the use and impact of tech for play in hospitals. And this was exactly the kind of project we were excited to be involved in. VR seemed to be a really good example of tech that we could use to have these impacts. So I'm going to hand over to Lisa, that's going to tell you about the journey that Leeds took to the point where we did this project.
Thank you, Sandy. Good morning, everybody. It's really lovely to see so many people on the call today, especially when the challenges with the NHS obviously keep us on our toes. So great to see everyone. Yeah, the build up to this wonderful project is, one of my highlights, really. We were very fortunate a couple of years ago to be nominated and won Play Team of the Year by Starlight, which I'm sure by now everybody knows about, and was a true honour to receive this prestigious award and recognition of the dedication and hard work that we were doing, especially over COVID. And I know that a lot of people on this call have been working non-stop at hospital bedsides. So that was the first sort of connection, really, when we got talking really closely with Starlight. We were very fortunate to have a consultant that works with us called Alex, who is very focused on VR and has lots of different ideas. And he had an idea about using VR after seeing it at a medical conference that he went to. And we sort of started these discussions quite lightly, but realised that the task ahead was not going to be an easy one and was quite a big challenge. So that's when we started the early conversations with Starlight, who expressed an interest that this could be something that would really impact on our hospital journeys for many of our patients, and they were keen to work with us. And from that, I reached out to our Leeds Hospital Charities, our charity partner. I had connections at the university, and we started in the beginning meeting to discuss how could we move this project forward. We knew that VR would have a great impact for children and obviously families as part of their treatment. However, the steps weren't easy, and there were a lot of things that we had to sort of cross and mead in terms of ethical approval, research approval, etc., which Sandy will touch on in a little while. I think the main point that I wanted to point out that this is just an absolutely fabulous piece of collaborative working that we've managed to do with Starlight. So, you know, as much as we're excited to tell you about this journey, we're very grateful to Starlight who were helping us funding and have been the main driver in terms of funding and research and helping us move this project forward. So before everybody thinks I'm a play specialist, I can't do that, I just want to reassure people that actually you can. Me and Tracy had not done any research before we did this project. This is our first project of research, and you know, with the sort of, you know, wonderful collaborative approach that we've all had and working together, it's what's able to achieved us and got us to where we are today. So I hope that you enjoy this presentation, and I look forward to questions throughout the presentation. Thank you.
Hi everyone, I'm Tracy. Thank you, Lisa. That was great. So the thing was expectation versus reality. So like Lisa's just touched on, we'd never done research before. So when I put my expression of interest in to Lisa, I thought, oh, you know, this is going to be a nice little job. So basically, this is my expectation versus reality. Next slide, please, Sandy. So this was my expectation. I thought I'm going to be doing some virtual reality distraction therapy for children having a painful procedure. And I might need to, obviously need to prepare them how to use the VR first. I might need to give them a bit of procedural preparation. I might need to make some reasonable adjustments. There might be a bit of paperwork, you know. I knew Starlight wanted some data. We're doing a study after all. So I might need a study day, like an office day once a fortnight maybe, to submit all my paperwork in, and that's what I was expecting. So next slide, Sandy. So this was my reality. I had to do the good clinical practice training, which was quite intense, and then I had to go through all this lot, consenting, adverse effects. I have to public speak quite a lot now, which I used to absolutely hate. There's all screening logs and publication writings and meetings and yes, all this. But the important part for me was that right in the middle of there is the important part, which is the patient in the middle of there. And that, as a play specialist, that was what was vitally important for me to remember. And it was quite difficult, really, to have. At first, I had two different heads on. I'd got this new head on where I was doing all this study work and making sure that I'd given, you know, the patients and families all the information they needed to take part and consent properly with informed consent, make sure I'd not forgotten to tell them anything at all, that actually I'd forget to put my play specialist head back on and, you know, tell them actually this is what's going to happen during the procedure. So it did take a while for me to merge the two. And I think once I got more confident in my new job, I was able to, you know, combine the two roles. But it did take me, you know, a few goes really to be able to combine the two roles and to have two different heads on at the same time, really. And next slide. So Lisa touched on teamwork. So this is my my view of the teamwork, because obviously there were other people involved as well, but they weren't the ones that I was directly involved with on a daily basis. So first and foremost, I had the research team. Because they took me under the wing, made sure I'd understood the training, which you don't realise until somebody casually drops in a question that you think, what are they talking about? And so there was a lady in the research team, Heather, took me under her wing and was absolutely amazing at making sure that I knew exactly what I was doing before I was set loose on my own, consenting people. Our chief investigator was the doctor that Lisa mentioned, Alex, whose idea it was. And the principal investigator was Lisa, and I think that may be a first in the country, never mind here, to have a play person as a principal investigator in a study. So that was fab as well. Dubbit were the local company who adapted the headsets so that they were fully wipeable and cleanable, and we didn't need them walking around like fighting zombies. They could sit still and just move, you know, with the head, so that we're not having them jumping around everywhere when we need them to sit still. So they adapted the headsets for us and provided them free of charge, so they were fab as well. Starlight, obviously, they funded my role so that I could do the study full time, and obviously it needed somebody committed to it full time as well for it to be successful, so that we could get round and get enough participants. But as well as that, they've supported me along the way and trained me as well in all things data, which I'm now obsessed with. But apart from that as well, the MDT the MDT team were vital, because it was, if they hadn't welcomed me into their departments and made referrals, I wouldn't have had all the participants that I had. So they were vital in the ones who did, you know, take me on board and were patient with me when I was walking in and making them wait until I'd got consent and everything. So they were fab. And of course, besides them, the patients and the families were the most important people as well, because without them, there would have been no study at all. So I'll just briefly say, because we've not said, but the study was for children aged 8 to 18 years. They could only take part in the study once as well, so that we weren't getting, you know, lots of the same people answering the questions a lot. So yeah, so I've got a video next that a young lady made, because Sandy's going to go through all the results of the study, but this video is quite nice because it's a young lady who liked using the VR, but this is when she's used it now, which is more than the once as well. But it's quite nice to watch anyway, because she says how it's made a difference to her. So I'll just finish with this little slide and then hand over to Sandy for the results. So we'll play the video. Sandy.
Sorry, my keyboard is quite sensitive. So I find that such a powerful video, and it really represents the impact that this study has had for a number of reasons. And what Tracy described has led to this being the first study of its size and kind in the UK. And we did publish a report. We talked about publishing a report. There's a link below that, and we'll share the slides, but also Amanda will put a link to the report in the chat in case you want to access that. But the reason why I'm saying this is the first study of its size and kind is because 110 children and young people took part in this study. And in the build up to this work, we did do some work with Leeds Beckett University to do a rapid evidence assessment of the use and impact of tech for play. And in all of the VR studies, the sample sizes were in the low tens. So this is one of the largest to have ever happened in the UK. I think there's only a few studies around the world that have looked at the use of VR for play in hospital that are larger than this study. One is in Hong Kong and one is in Australia. So this really demonstrates how huge a study this is. The other thing to note is that this is one of the very few pieces of action research that has been conducted by a play specialist. And as indicated by Lisa, this has had a significant impact on this work and on the impact of VR. So it is really noteworthy to see the impact that a play specialist can have on research, and it should continue happening. But all in all, VR, what we found was that VR has a positive impact on the experience of treatment. Could I please ask that everyone switches off their microphone? Thank you. Hiya. Thanks. So in terms of why we think that's the case, well, we just watched a video that demonstrates that, but 91% of children and young people chose to use the VR. Who chose to use the VR said that it made treatment better. And 87% of children, whilst using the VR, said that they felt little or no pain. And this is quite significant. Because we also found that children, when they were using the VR, tended to feel more confident, more happy, more relaxed, and not worried, not anxious, not in pain, and not afraid. And that is exactly the kind of impact we were seeking to have with this VR. And in 79% of cases, the VR was inclusive of most children and young people's needs. There were a few cases where VR was not appropriate for treatment, either because of the type of sedation they were having, or for some children and young people who are neurodiverse, there was extra support that was needed. But all in all, it's quite an inclusive form of distraction therapy. And we received overwhelming feedback from children and young people about how positive experience they had. Similar to that video, there was another child that told us, I felt really relaxed and I felt a small pinch and then it was over. I didn't feel much pain at all. I was more focused on the VR than what was going on around me. And we can replicate that quote, tens of times from all the feedback we received from children and young people, which has led us to believe that VR is an effective form of distraction therapy. We really wanted to have a comparison in this study, but 95% of children and young people picked VR as their distraction of choice. For the first half of the study, we had VR and an iPad and standard distraction. For the second part of the study, we actually had other forms of tech for play, like gaming, projectors, and so forth. But still, most children and young people wanted to use the VR. They were excited about using the VR, which shows that it's popular. And 92% of the children and young people found it easy to use. And for those who didn't, Tracy was there to support them. And that was really powerful. And most of them, as I had mentioned before, talked about how distracting it was and how it took them away from the experience of treatment, the pain of treatment, the anxiety of treatment. One child said, it was good, it distracted me, I enjoyed it. Pain was a lot better, I usually cry. Another child said, it was fun and it did distract me because I didn't really notice. And so many children told us how they didn't notice what was going on and how they're usually crying and how anxious they are, and VR made it all better. But I think it's important to note, it is important to have a trained health play specialist delivering the VR as part of treatment. A lot of the other studies that we looked at usually would be a researcher such as myself, or another medical professional who's delivering the treatment, delivering the VR. And they weren't really trained specialists in how to integrate play into treatment. But by having a play specialist delivering that work, they're able to see how to integrate VR into that setting. They're able to make that assessment of whether the child or young person is ready and what their needs are to be able to integrate that into treatment. And what we found really interesting is 81% of the children and young people referred to this study actually took part. And that's quite a significant number. And over 70% of the children and young people who took part in the follow-up survey. Now, as a researcher, I can say that I would pop open the champagne if 30% took part in the follow-up survey. But 70% is huge, and it's just a testament to the relationship that Tracy had with all the children and young people who took part in this study, and how engaged they were with this treatment and how much they enjoyed it, like we saw in the video that was demonstrated. And I can't emphasize enough how important it is to have a play specialist delivering this. There were other things that we found as a result of our findings. We also noticed there were efficiencies that could be made by using VR, and that could have an economic value to the NHS and the NHS's use of resources. So I think most of you will probably know this better than me, but children and young people who are anxious and stressed about treatment can often resist or delay treatment, and sometimes that treatment requires multiple attempts. But the majority of participants who were able who took part in this study were able to complete treatment in one attempt and in under 10 minutes. And in some cases, VR was used instead of sedation and anesthetic. And I'm going to talk about one of those cases. So there was a young man, 16-year-old, who was booked in to remove both toenails. And usually that procedure would have been conducted under general anesthetic. However, in this case, this very brave young man said that he would do the procedure using VR and just local anesthetic. And it was a success. And what this meant was that there were savings in terms of staffing costs, and we were able to capture those. So this surgery took £47.04 less to complete. But also the time in releasing those staff to do other things was an efficiency that was made. And had that young man undergone general anesthetic, he would have had to stay in hospital for longer, which has another additional cost. And in this case, they did use the operating theatre just in case something went wrong and stuff. But if this procedure could be conducted outside of theatre, that's another saving, which shows the impact that VR has in creating efficiencies in terms of time and cost for the NHS. So all in all, we found that VR had a significant impact, particularly if it's delivered by a play specialist. And now I'm going to hand over to Lisa and Tracy to talk about the difference that is made to Leeds Children's Hospital and what findings and what were the impacts of these findings on the hospital.
Thank you, Sandy. So in terms of patient experience, I think the report and the findings speak for themselves. And obviously, you know, we're very pleased with the feedback we've had. Safety is another big one that's really helped us move things forward here at Leeds Children's Hospital. It's obviously safer to use VR for some procedures rather than give a child a general anaesthetic. The risks are a lot lower, and we've already touched on some of the cost savings there. Now, in terms of future plans, this is where I get really excited. So I think what I want everyone to take away from today is that we had an idea, and as a team, we did a great piece of research And from that, the future plans are going to hopefully just continue to grow. Sometimes you see a project run and nothing comes from it, but I feel really excited about what our next steps and future plans are going to be here at Leeds Children's Hospital. I've already managed to obviously explain and meet with our TRI team and senior members of management team at Leeds Children's Hospital who are really getting to understand now the benefits of VR. And one of the advantages that VR brings is it could have some cost savings and waste reductions. So from following on that, I have just made an application a few months ago to our charity partner Leeds Hospital Charity, where we hope to be able to continue with the VR play specialist for 2 years, to be able to continue and follow on with some of the work that Tracy has done. And a big part of being able to make that happen, we're just waiting confirmation in the next couple of weeks, is the evidence and the research that we've pulled together with Starlight and obviously Sandy. So I think that is really exciting. Another opportunity that we've had is a lot of our psychology team members and MDT members have seen the benefits of Tracy's work and the impact that it's had on patients. So we've had an interest from our psychology team, and I've met with their management team and their TRI, and we have now been very successful in getting a secondment for 1 year for a health play specialist, which will be Tracy, as we are coming to the end of the project with Starlight. And Tracy will be going to work with this team of psychologists, the first health play specialist to join the psychology team, and working and holding her own caseloads in terms of using VR with a different group of patients, working on obviously the individual needs of the children, but with a specific focus around rheumatology patients and a lot of the procedures they have in terms of joint injections and having to have steroid injections. And Tracy's already had some success there with using VR instead of Antonox, and we've even had a couple of patients referred from other children's hospitals to use VR. So I think that's really exciting that Tracy's going to be joining a new team working within psychology. Hopefully we're going to get some funding and she'll have her own VR headset, and she will obviously, you know, really continue to spread and, you know, share that knowledge. We've also done with some drop-in sessions with Starlight, where we got other professionals, physios, OTs, etc., to come along and try the headsets and things. And again, that was a really sort of, you know, beneficial experience for a lot of our MDT members that were a little bit curious about using VR. The next step is in discussions with patient experience again, because what we would like to do is identify a space where we can look at using VR instead of a general anaesthetic. It would obviously still be on a very selected patient caseload, but just to give you an example of some of the things that really don't sit well with me, we currently do things such as a renal biopsy for a child under a general anaesthetic. And some children and young people, when they progress to adults, will just be expected to have this done awake, which is, you know, not a pleasant procedure, and it's the same for liver biopsies as well. So if we could maybe incorporate not going from the general anaesthetic to having VR for the procedure, to prepare them when they go to adults, that the next step is, unfortunately, there is nothing in terms of local or general anaesthetic. I think it could be a really good tool to use to transition children from having a general anaesthetic to VR being their next coping strategy in terms of some of their treatment. So that's what we're currently looking at the moment. And it's really, really exciting. And as I say, you know, Tracy's going to move on now and tell you next about the different types of headsets, which I think are also really interesting. So our future plans are, we're aiming high, but the message I want everyone to take away from today is we have an idea. We've not got there overnight. It's been a lot of hard work, and it's been a couple of years for us to get to this end product. But I really do believe that VR is a product that a health play specialist can use within their kit, and, you know, we use within their sort of remit to enhancing it and making more positive outcomes for children coming into hospital. Thank you. Tracy, I think it's you next.
Right, so I just want to add in as well, because we seem to have lost a bit of an explanation slide as well, but about the procedures that we did do for the study. So the most common procedure was a cannulation. I'm sorry, I don't know if you can hear that noise, but I think I've got a bedpan washer or something above me. If everybody can hear that noise that's going on in the background, it will stop soon. So yeah, it was cannulation, blood tests and portacath accessing were the most common procedures, but we did also have, Lisa touched on joint injections, we had ITB pump refills and some dressing changes as well, for various different things, and pin site dressings and things. So there was a wide range really of procedures that we used it for. Also, just obviously, we did have a lot of children who really loved the VR and it worked really well for, and I think that was probably basically because they've got their eyes covered and they can't see the procedure, and for some children that's great because they don't want to look. For some other children, whether it's a sense of control or whatever, they need to look at the procedure because that's their coping strategy. And obviously it's not about us forcing the child to have something over the head and not look. So the ones that were not in the percentage that Sandy presented were the ones who needed to watch and preferred to watch. So I just thought I'd bring that one up before somebody asks the question anyway. So headset trials, yeah, so the original headset I was talking about, it didn't have any screen mirroring, which is when you have a tablet connected and you can control what's happening on the headset for the patient so that they can just sit and do the fun bit and just be immersed in it. So the screen mirroring wasn't on the original one, but we've been trialing different headsets with the screen mirroring function on there. And obviously it's a lot easier for us to set up for them and a lot better patient experience. Also for the parents, they can watch what their child is seeing on the screen as well. So it's good because staff and parents can communicate and, you know, engage with the child while they're in the VR as well, especially if, you know, they need just a bit of a prompt to be immersed when the procedure's starting to happen. So the new headsets, we've had one that we've been trialing for, I think I've had it 5 months now, the Dr. VR headset. We've been trialing that one, and then we've got another one coming soon, Healthy Minds, that we're going to be trialing. I've also still been collecting data, which I've been sending off to Starlight, and that's been really good because that's enabled the data analysts at Starlight to look at the data that I've sent through, which is really about the next thing, which is repeat use. So they've been able to look at, you know, what we wanted to know. Does the novelty of VR wear off, or is there actually benefits to repeat use of VR? So we've been able to look at that as well with Starlight from the data we've collected. And obviously patients like the young lady that was in the video, she's really benefiting from repeat use now because she's just so relieved when she comes in and can have it. And it's so lovely because obviously children who did really want to use it again but were told no, you can only do it once in the study, they can all use it again now, so that's really good. Obviously there are other children who, yes, they used it once during the study and then they've come and said, oh no, I'm all right, I don't want it again, and that's fine too as well, because if they want to go back to their usual coping strategy again, that's great for them. So the other part is the training. So obviously, because my job was always supposed to be temporary, it was 6 months and I've been here, what, 16 months or something now. And so obviously the next step was for me to train all the other play staff here at Leeds, how to use the VR, how to assess children and make sure, you know, that they're good to use the VR. Because it's not fair for us to have proven that actually it's fab and have all these children who are coming into hospital wanting to use it again. And because we do have a lot of regulars, and just say, oh, sorry, Tracy's gone now, you can't have it. So that's been a big part of my job now, is training all the other staff and also training some staff from other hospitals as well, which I'm sure Sandy's going to go into as well. But yeah, that's my bit. That's what I've been doing.
Thank you so much. And if anyone wants to find out any further details about our study, again, I'm going to ask Amanda to put a link to the report. There's a lot of information there about different types of treatment and the different results we had. And we will continue to be publishing results as we go along in this study. So we will also put a link to a form where you can register your interest to hear a bit more about VR, and also if you would like to take part in any of Starlight's work around this. So without further ado, I am going to, if I can, I do apologize. My screen is really sensitive once it even changed slides without even touching it. So hopefully you'll stay on this slide, but I am going to hand over to Amanda, who is going to facilitate our Q&A. Do we have any questions?
Yes. The first one was, well, there was two questions about the recordings and how they will be made available and if there'll be access to the previous webinars as well.
Yes, we will be making all of those available, and you will be receiving communications around the recordings and also the slides and further information about all of these topics.
Super. The next question was that they've been trying to get VRTT for over a year to get one at their hospital, and it's been really hard and they're still trying. So how do we get training in this area?
Should I maybe come in there and just say something? Abby, I really get that, you know, it's really difficult to get a VR headset, and you know that's why we've really partnered with Starlight to do this piece of research. So what I'm going to say is that it's exciting regarding this piece of research, and maybe Sandy, you want to say what you are thinking from Starlight's point of view, which could hopefully be the next steps in terms of headsets. Do you think that's reasonable?
Yeah, so I'm just going to go to the next slide just temporarily because I think that that is relevant to what we're talking about here. So the next step for Starlight was that we've expanded the study to see if VR continues to have a sustained impact on children and young people over time. So whereas our previous study, we only used VR with children once, now we're expanding it to look at repeat use, like Tracy said. We're also expanding the sites in which we're doing this in. So we now expanded it to 4 further sites, so Birmingham, Noah's Ark Children's Hospice, Sheffield and UCLH. And we are looking at how VR is being used in those settings, whether we continue to see the same impacts. And part of this work is, this is a very supported piece of work. So we worked with Tracy to create a manual on how to use VR with top tips on how to use VR. But we also offer training as part of this work to all of the sites into how to use VR, what is best practice and so forth. And we have incorporated into the delivery of the service reflective practice sessions once a month, and we provide continuous support on how to use the VR. So it's a fully supported journey. So if anyone is interested in being part of any of our VR services or would be interested in receiving something like this in their hospital, please let us know, because we're always looking for new sites and funding to help us deliver this to further sites. We would be really interested in hearing from you. But I think it would also be interesting to hear from Tracy about the training that you've provided at Leeds Children's Hospital and what your staff has also found useful in terms of training around VR.
Yes, so like I say, I wrote a training manual that Starlight has printed up and made it look all lovely for me. And that goes through how to exclude patients, because it's things like if they've got epilepsy, they're not allowed to use it. If they travel from really bad travel, if they suffer from really bad travel sickness, they might feel dizzy on some of the games. So we'd, you know, make sure that they only played something that was more of a passive. I noticed somebody else has asked what do they actually see on there as well. So yeah, some of them are just videos that they're watching, which are a lot gentler than the games, which have a lot of motion in them because it's like they're racing or traveling through. So also it's top tips about, yeah, those kind of things, and explaining to them first that they're not going to be able to see, so that you can find out which of those patients do need to look at the procedure, because they need to cope, and warning them that they're not going to be able to see, because then they kind of eliminate themselves from that. Some might decide they still want to use it, but at least you're aware that they might need to take the headset off halfway through. And it's just things like that, really. I mean, I could sit and go through the whole manual, but yeah, it's tips like that, just so that you are preparing them, making sure that things that might be an issue they're aware of first, so that they're fully informed before they make their decision, really. But yeah, the training manual, it's all in there, so it's quite good to give out with the training. And then obviously the other part is training them actually how to use the headset properly, which is just basically the training that I will have had off each of the different providers on how to use it, and because some of them are quite temperamental if you don't turn them on in the right order, and you know, and how to clean them and everything properly, so that we're following all the guidelines. Yeah, there's quite a bit in there, really. You'd think you'd just be able to switch it on and stick it on somebody's head, but it is a bit more in depth than that. I hope that's answered that question.
And if anyone is interested in, seeing the training manual and hearing more, please do fill in the form and we can get in touch and talk to you about the VR and how you can use VR in your settings. Can we have the next question, please, Amanda?
Yes. What adaptations need to be made to VR sets to make them easily cleanable?
Right, so normally on the VR headset, the straps that go around the head are a material. So they did get us some, every company have got the same ones. They've got some proper rubber ones that are fully wipeable. And also the cushioned insert that goes in is usually a material one, and that's a rubber one as well. And other than that, then it's totally cleanable then.
We should just say that we did have to obviously get IPC clearance and write a SOP in terms of obviously supporting this plan. And we had some little bumps in the road. You know, we used it once, Tracy used it once with a patient back when COVID was really high, and we cleaned it and everything. And then a couple of hours later, we got a result to say that that patient had COVID, and we panicked and blah, blah, blah. However, you know, we'd followed the strict, obviously, SOP guidance in terms of cleaning it, and everything was fine. But we did have a little, oh my goodness. But having a SOP, standard operation procedure, and obviously all that Tracy said are key, really, to be able to get your IPC guidance to sign this off.
And we would recommend doing that in any hospital.
Lovely. Another question asks more about the activities that the participants do in VR. So a bit more about the games.
Yeah, well, it depends on the headset, really, but most of them, the racing ones, they tend to be, the game actually just moves forward without them having to do anything, and then they just steer with the head to go side to side. On the Dr. VR games, they have to steer so that they go through hoops to collect hoops. I say to them, it's like they're actually Sonic the Hedgehog going through the hoops. And they get points by collecting. Then there's different games with that. The original headset we used for the study, there were different ones. There was one where they were rescuing cows from alien abductors. And there was one where they were a bee collecting honey on a farm. So yeah, depending who the provider is, really. And then and which headset you've got. And then the videos on the Dr. VR that I've got at the moment, most of them are actually proper videos that have been filmed. There's an under the sea one, or there's ones with wild animals, with lions and elephants and things, or cities around the world. And then there's some animated ones. There's a space one that's really popular and a dinosaur one. And on the other headset that we used in the study, there was similar. There was a beach and a forest and yeah, all different scenes, but they were all animated on that one. There were no actual footage, so it does depend on which headset you're using. The Healthy Minds one is very animated as well, and there's no games on it, but it's as though there's more going on. There was a pirate ship one where it's saying, come over here, look at this, and and there's things going on all the time. So even though the games tend to be more immersive than the experiences on the one that I've got now, the experience on the Healthy Minds that I'm going to be trialing shortly was more immersive because it had things going on within the experience. So they're all very different, and I think we'll all have different uses as well and be valuable in different areas.
We'll just take a quick break from the discussion questions here, just because we have a hand up from Sandy from Glasgow, if you want to ask your question. Unless you might have put your hand up by mistake. But if just you're on mute in case you are trying to ask a question. Okay, we'll go back to the question just now, but Sandy, if you want to ask a question, just maybe you can write it in the chat for me and I'll read them all out loud. Let me ask the next question. Can I ask if it has been used with children and young people with a learning disability and/or complex needs, and if so, what was the outcome?
Go on, Tracy. I think Tracy's got some wonderful experiences to share, and I think we could have, if we had funding, a play specialist for VR just to support children with learning disabilities. Tracy, over to you.
Don't big me up like that, Lisa. We have had some really big successes with learning disability patients, and the autistic patients in particular as well, because a lot of them really like technology, don't they? You can't get them to look up from the tablet normally, and they absolutely love the VR. We have had some big successes in that we've had children who I've had a child who his mum said, we've been trying for over a year to get his bloods, and he just came in, put the VR on and had his bloods done. And we've had a few like that really, where they've been saying, oh, it's going to have to be a general anaesthetic because they're not going to sit still and have this done, and then they have had it done. That's one about repeat use as well with that, because I don't know whether sometimes there's a bit of the fact that they've not actually quite processed what's going to happen and what is happening until afterwards, and then whether they would do it again next time. I have had a couple who have come back and had it done again next time and it still worked, but they are a bit more wary of you. Not that we've tricked them into it, because we have told them what's going to happen and shown them what's going to happen, but yeah, that's one that I find a bit tricky. It does work, and it's knowing what they understand about it really, even though we've told them as well as we can, and they do it because they do give their arm out. It's not like we've restrained them. They volunteer their arm while they're playing on it, but then when they think about it afterwards, one of them did have a meltdown afterwards when he realised what had happened, even though he'd been fine during. So yeah, that's a bit of a mixed answer, sorry, but yes, it does work really well with some, but just a couple afterwards, when they've processed it afterwards, maybe it's not best to use it again with them. So a mixed reaction, but some great results for some. That's the short answer.
and we used alternative actions, like we found like a protective child that's dealing on something.
Sandy, you're a little bit quiet there. I can't really hear you.
Oh, I don't know. I was just saying we used other forms of distraction. Can you hear me now?
Yeah.
We used other forms of distraction. Like there was one example where we used a projector, wasn't there, Tracy? That you found that was particularly successful. Where we projected.
Yes, there was. Yeah, that was a young man who was sedated as well for a particularly painful procedure. I think he was having Botox injections in his legs, So he was sedated and he just wanted to watch Mr. Bean on the tablet. So yeah, we projected it on the ceiling through a projector, and he never moved. He just watched Mr. Bean all the way through. So yeah, that was great. Because obviously in the study they didn't just have the option of VR, they had the option of other forms of distraction as well that they could choose.
The next question is, would you think of expanding to community play?
I'll answer that for Starlight. I would say we're always keen to try new things, so definitely, and whoever asked that question, please do get in touch about how we could use it in community play, because we would definitely be interested in hearing more. I don't know if my colleagues at Leeds Children's Hospital have any recommendations around that, but yeah.
Yeah, I've just had a couple of questions that have come. We've got a new palliative health play specialist, and not so much from the gaming point of view, but maybe in aid of, like Tracy said, the relaxation elements of some of the kit might be helpful for some of our palliative patients at home. But I think, you know, the aim and the focus of the NHS, especially around children, is to try and obviously keep children at home in a community base where we can. So I can't see absolutely why not. It can't be used for dressing changes and, you know, injections, all those things that we can do at home where possible. Then absolutely, I see it being a great piece of kit. You just need to find the funding and obviously, you know, sell it to your sort of seniors that this is, you know, going to really enhance obviously children's experiences at home as well as in hospital. And it may be a tool that, you know, they can manage and cope with that procedure at home using the VR. And then when they come to hospital, they've got the VR coping strategy to help them when they come into hospital. So I think it could be used in a range of, you know, procedures. I've been asked the last couple of weeks, can we use it for immunisations? Who knows? I think we could. And could we use it in schools for children that are stressed and need a little downtime in school? Again, both different projects needing their own research, but I think, you know, I think it's got great possibilities in, you know, supporting a lot of children.
Super. Another question was, is there any information on which headsets are best to use in the hospital setting and where to purchase them from?
Well, this is one of the reasons why I've been testing different headsets. Sorry, I should have said that in my bit, for Starlight, because obviously they're expanding into different hospitals and looking at funding headsets. And so part of me trialing the headsets as well was to work out which were the best ones. Unfortunately, at the moment, I haven't really found a bad one. And because they are so different, like I say, a lot of them have different uses, so it's just trying to fathom all that out and make everybody else's job a bit easier, I think, really, by somebody trialing them all so that they know the differences rather than everybody having a different one and saying, oh yeah, it's great. So it would be great to trial them all and have a big, you know, written report of this one's good for this one's good for this. That'd be fab. But yeah, whether we can actually do that or not is another thing.
Just to add to that, currently we're, as Tracy said, we're looking at different headsets. I would say that when we did this study, it was with a headset that we adapted ourselves to use in the study. However, there are companies out there that do manufacture headset or use headsets that are already specially adapted for hospital settings. And our recommendation is to use them because they've gone through all the testing required in terms of infection control, in terms of understanding the needs of a hospital. To, you know, it would be easier to get a headset from them rather than getting a headset from a local shop and adapting it, because they've already thought about all the things that you need to think about to put it into a hospital setting. So what Starlight's doing now is trying to look at all of those different headsets and identify what are the pros and cons of each of them, and use that to inform the future work that we're doing in this area and the offer that we have. So if this is something that interests you and you would like to collaborate with us and get a headset from us, please do register your interest. I'll be sharing a link at the end of this presentation, but also Amanda can post it in the chat to talk to us about the different headsets we've looked at and we've used, and we can have a conversation about that. So far, we've identified Riscape and Dr. VR and Healthy Minds are the two companies we are exploring at the moment, and there may be others out there. So we've done some groundwork around that, which we're happy to share our findings around that. So please do get in touch with us to have a little chat.
Yeah, I was seeing quite a few things in the chat there about registering interest. So please just put it in the link. That'd be great. We'll get back in touch with you. And the next question was the trial done on pre-planned procedures? And how many times did you have to see the child to prepare them for the use of the VR headset?
Right, so yeah, this was the thing when I originally started. It was just anybody who referred to me, but we soon found that staff on the wards couldn't really refer a patient, because usually if they need a cannula, it's because the cannula's just gone and they need a cannula now and the doctor's coming now or whatever. And it just wasn't practical really, or doable for me to just turn up and make the doctor wait. So it didn't really work on the wards. So where we found it did work was, like say, planned ones in clinics where the clinic staff could refer, because they could see who was coming in tomorrow, they knew how old they were, they knew what procedure they were having done. And also on our daycare unit, where children come in for regular IV therapy just for like an hour, they need a cannula in to have their IVs, and then they'll have the cannula removed and go home, come back in 6 weeks. So those patients were ideal as well, because I could look in their diary and see who was there and we could book them in. So yeah, definitely that's where it worked the best for the study. And then obviously with the training now, when all the other play staff are going to be trained to use it on their wards, it should be easier for them to use the VR, because hopefully they will be able to just grab a VR and use it there and then. Obviously, the problem with that is we don't have all the VRs that we need at the moment, because we could do with one on every ward. So that's also an issue as well. But ideally, that would be the best thing, that the person on the ward who knows the patient would be delivering the VR distraction on the wards, but the planned ones could be booked in with somebody. Hopefully, if Lisa gets the funding for the 2-year play, a person doing the VR, then they could go around doing all the planned procedures, which would be great.
Super. And we have 2 last questions. One was about who are the companies that are providing this equipment?
So the first headset we used was a tech company kindly gifted the headsets. It's a company called Dubit, but they're not specialized in this. They do work on tech, and so we use those headsets for that study. What we recommend is that anyone who's planning to do this and doesn't get their headset from Starlight uses one of the companies who have tried and tested VR in these settings and have adapted the VR for hospital settings. And the 2 that we've been trialing so far is Riscape with the Dr. VR, and we're about to trial Healthy Minds. So those are the 2 companies we've identified so far in this space. There is 1 or 2 others that we're going to be looking at, but so far the only one we've actually tried and tested is Dr. VR by Riscape.
Yeah. And time for one last question. What is the youngest age group that you have used VR successfully with?
To Tracy for this one.
I think successfully probably 6. I did try with a 4-year-old, but I was scared he was going to smash it. He was literally pushing it away and crying because he didn't want it, and Mum was trying to force it on him. And I said, I'm not here to distress him and traumatise him with something else. I'm here to help him. If he's scared of the VR, then, you know, I'm not putting a VR on him. So, yeah, I think 6 some 6-year-olds have been fantastic on it and love it, but it does definitely depend on the individual child. And I have heard that some 2-year-olds have used it if they've just been watching something in other hospitals, but I've not used it on anybody so young, really. Yeah, so I would say 6 has been my youngest successful one.
I just want to add, this is a bit experimental because 6 is under the recommended age group use, but because we are in a hospital setting, we are and we're testing it. What we're finding, it is successful with these younger age groups, which is really exciting, actually. Cool. Well, thank you, everyone. We're almost at time, so I'm going to move this on. Thank you for all your questions. If you have any others, pop them into chat and we'll aim to get back to you with answers. And please do register your interest in taking part in our work. I've already taken you through the next steps, so we've expanded the study to 4 further settings, and watch the space. In future, we'll be talking about what we found and the impact that this further work has had, including the work that we're continuing to do at Leeds Children's Hospital. We're continuing to be sponsoring the VR that's in Leeds Children's Hospital. The other thing I want to say, this was the 3rd of our webinar series. Next week, we have our 4th webinar, which is Play for Mental Health and Resilience. That will be hosted by our very own head of play, Laura Walsh, which is really exciting. I do recommend coming to that session next week. It's on the 2nd of November at 12:30. I hope to see you there. And that brings us to the end of our presentation. I just wanted to share, we didn't have Alex with us today. He was the consultant pediatrician that was involved in this study, but this is everyone who was involved in the study. We have a link to the report. If you want to ask any questions from Starlight or any questions from me, please use our insights@starlight.org.uk email address. And we also have a QR code there, which you can use to scan, and that will take you to the form as well. And Amanda will put a link to the form in the chat. But thank you so much for attending today. It was such a wonderful discussion. We really appreciate you taking part in our webinar series. And yes, if you have any questions, please do let us know. And it was so nice to share this with all of you.
Thank you very much, everybody.
Thank you to our panel as well, which is what I should have said. Goodbye, Jenny.